looking at H91. We're on page, what, 19?
Yeah, 20.
Okay.
Let up, great. Okay. So we're looking at draft 2.1. We discussed changes and how we refer to these sections when I was last here, but you don't have an updated draft in front of you at this time. So the first part of this section is the implementation planning. So this is the 2-part plan that's coming from the department in collaboration with partners. And the first part of the report comes in October, and then you get the second part of the report in January. Following, I can go through all those different, but following that is the regional needs assessment that the CAPS will be doing. The first part of which comes in January, the second part of which comes in April. Okay, so I'm going to start with going through the October report. DCF in collaboration with community action agencies, regional advisory councils, statewide organizations serving households that are experiencing or have experienced domestic or sexual violence shall submit the first of 2 written implementation plans to the policy committees and joint fiscal, outlining its initial plans for the implementation of VHARS by July 1, 2026. Specifically, the first implementation plan shall include a process that community action agencies in coordination with the department shall use to conduct regularly occurring regional needs assessments and develop future regional plans. A recommended performance measures to evaluate the community action agencies and the statewide organization providing services to households who have experienced domestic or sexual violence, including the provision of any previously agreed upon information to enable the department to evaluate services provided through grant funds, the effect on households receiving services, and an accounting of expended grant funds. Performance measures that may be specific to an individual region of the state or provider. The report shall also have recommended eligibility for each of the services offered. In subdivision 4, guidance regarding when extreme weather event shelter shall be operated, including flexibility for regional weather conditions. And lastly, for the October report, recommendations for the appropriate level of required intake and assessment processes for each type of shelter that a household may utilize.
Okay, in here would be a good place to put estimated administrative costs for doing these programs.
Yes, and this is why we've asked to have the budget information coming to us. We're going to see that on Friday. We asked for folks to get together. We need to understand how much money this is going to cost this year out of the 10 million.
Yes.
And then going forward, what will it be? So right now we've got $30 million in the hotel motel GA program. Hopefully that will start to come down because we're going to be setting our goal for that. Savings there. See what happens.
Okay, but I think we need an estimate from each account of their administrative costs.
Yeah.
I think to assume, given the present threats nationally, that we are going to cut down might be foolhardy. If they cut SNAP, if they cut any or reduce any of the housing programs, we are going to see an increase in people needing services.
Absolutely.
And we don't have the ability to build to meet that need.
No, I think the benefit here is having a very much more defined system.
Yes.
System for intake, system for eligibility, system for support services that
I think that's good. Yeah. given that we have a set amount of money,
Yeah,
I think we need to know what each cap says it is going to cost them on an annual basis to administer the program.
yes.
And that may come in the budget. But I think,
That's what I'm talking about. So I'm not talking about that budget. I'm talking about how are they budgeting this
yes,
money
that's,
and what will it look like going forward to support this program? Yeah. So now we have HOP, which is doing a great deal of work, and they continue. We just in the budget conference committee just agreed on the 3.35 increase base with them. So it comes out to close to $30 million for HOP.
Yeah.
And now, but we're also have $30 million out there for the hotel motel program. And one of the things that I'm interested in is how is that money being used? We get quarterly reports, but I'd like to know very definitive amount of money, how that's used, and then how will this bill help? What's the administrative cost for the bill?
bill. I mean, we've got 5 new centers as opposed to 1. Can they do this more efficiently?
Yeah, that's a question.
Yeah.
So I'm hearing the conversation. I hear that you want the estimated annual admin costs.
Yeah.
Yeah.
I'm wondering if this is the right place for it, because this is the report coming from the department, and I think
Okay.
you want that information from the cap.
Yeah.
So the first cap report back is in January as part of their regional plan. Does that work? Or do you want something earlier?
We aren't dumping this on them this year, right? So,
I think January does make sense. And if there's anything in the BAA or whatever,
So no,
we can decide.
okay. This, oops,
No, it's very in.
oh, okay. The second part of this report back is January 2026. DCF in collaboration with community partners, the regional advisory councils, statewide organizations serving households that are experiencing or have experienced domestic or sexual violence shall submit the second of 2 written reports to the policy committees regarding implementation for July 126. And then we have a list of what is in the second portion of the implementation plan. Most of this, as you can see, comes from the as passed House version. Funding allocations among the community action agencies and other providers, including for services specific to households that are experiencing or have experienced domestic or sexual violence, additional state and federal funding and other resources identified for the program, appropriate supportive services specific to the level of a shelter household utilizes, or whether the household is at risk of homelessness or experiencing unsheltered homelessness. Establishing an appeals process that includes a hearing before the Human Services Board and an option for an expedited appeals process. Expanded use of 211 within the intake system. Whether continuation and emergency shelter should continue an expectation regarding household participation in case management services or other expectations, such as night limits on the use of hotels and motels. And if so, what elements and in what circumstances participation in case management services or other expectations should be applied. Number 7, whether the use of emergency shelter should include financial participation, and if so, what that participation should include. 8, how best to ensure that there's equitable access to shelter and supportive services for households experiencing homelessness. And 9, any anticipated challenges requiring a legislative solution. So those are the 2 department report backs in October, January. And then in section 8, we transition to what we will call something about regional plans or regional assessment. So prior to the enactment of VHARTH, the Community Action Agency shall conduct initial regional needs assessments in accordance with the process developed in 7A1 of this Act. 7A1 is the department report back in October and one of the items reported back is a process for how these ongoing regional assessments shall be conducted. So they will follow that proposed method. On or before January 15th, Community Action Agency shall submit one comprehensive progress report, including estimated fiscal year 27 budget needs and estimated administrative costs. On or before April 1, the Community Action Agency shall submit one comprehensive report detailing the results of each of the region's regional needs assessment and implementation plans, which shall not exceed the budgetary estimates provided in the progress report. The initial
Make sure that when we mention community action agencies, we also include the network.
Okay,
That's all.
producing it. Okay, thank you.
But they also have to submit a progress report.
The implementation
Want to know
plan.
what they need.
Okay. The initial needs assessment conducted pursuant to the section shall include addressing progress in reducing the number of households experiencing homelessness in the region, assessing the rate households placed in permanent housing return to homelessness in the underlying regions, identifying resources developed and utilized in the region to address homelessness, and efforts to improve the equitable distribution of these resources in the region, reporting the rate of household participation with coordinated entry processes and case management services, identifying system gaps and funding needed to address those gaps, including periodic inflation adjustments, and utilizing data, including point-in-time count, coordinated entry assessment results, and community conversations. That list should look familiar because we've already read through it once today. This is also in the permanent language for regional assessments. So that's it for the reports that you're, sort of the planning reports that you're expecting.
Okay. Any questions there? Anything else we need to have? I'm wondering. So we talked about the whole zoning type issues. And the community concerns. Do we want to put anything in here coming back from the organizations that are on the ground and what problems they're having in their?
We did something in the housing bill last year.
Yeah,
We got the shelter in downtown.
yeah,
St. J that had to be blocked by ordinance. And I would, Keisha would know, but they're
I'll have Keisha.
Yeah.
But I
There
mean,
was a-
keep,
pretty significant.
maybe keep that thought open about, I mean, the organizations are the ones who know
Yeah.
where shelters and housing might be able to go and what their communities are like and what's needed.
Some communities.
So we can't just say do it. As much as we would like to, it's not our jurisdiction in here, but we can certainly.
But they tend to be in communities that have access to resources.
Yes.
Public transportation.
Yeah.
Social services. So they tend to be big towns or cities.
Right. Or central. Okay. So we'll think about that. But having some, I think some attention to what's happening at the local level that might be impeding progress. Okay, yeah, otherwise we're gonna take 2 steps forward and 3 steps backwards.
Okay, I love that. Okay. That brings us to page 25. We have language in the PA chapter. And let's see. Right now it reads, except as otherwise provided in this chapter, Commissioner of Mental Health and Dale, within the limits of funds designated by the General Assembly for this purpose, ensure that community services to persons with a mental condition or psychiatric disability and persons with a developmental disability throughout the state are provided through community mental health agencies, including community services to persons participating in VHART. And then the commissioner shall designate public or private nonprofit agencies to provide and arrange for these services.
Right, that would just help coordinate services from RDA services.
And then in section 10, this is the chapter on community action agencies. Mostly we've changed the room to community action agencies, updated some antiquated language, amended how the board structure works, mostly by being less prescriptive. So I will not spend no time there.
And just FYI for committee, if you have specific questions about HOP and what it does, Lily Sojourner is in the room and can answer those questions. And I did go back through your testimony again, because you have two sets of spreadsheet, which files. And yeah, it was very helpful. It's really very helpful.
Okay, so next we get into the appropriations. So we have the $10 million appropriation for the transition. 6.5 to DCF for distribution to community action agencies, statewide organizations serving households experiencing domestic and sexual violence. Subdivision 2, 500,000 to DCF for contractual and other system transformation assistance. And subdivision 3, 3 million to DCF for continued development of shelter capacity in the state. And then,
So this, let me ask a question about this, because I'm curious as to how this is $3 million additional to what is currently in the budget. And so I'm looking at both at Katie and I'm looking at Commissioner Winters. How is it that it's here and not in the budget?
I don't know, Seth.
There it is.
So there's an additional 2 million proposed in the
Yeah,
budget
yes,
for
there is.
expanding shelf in the budget. And so this was additional
Right?
added by the House Human Services Committee to this.
And is it meant to be used within the next fiscal year, within 26?
I don't know their intent. I would assume so. And
Can we use it?
that's a great question because we have a lot of, I'm going to look at Lily here. We have
Yeah.
a lot of projects in the pipeline
Yes.
that may or may not come to fruition. Things happen, as they always do when we're trying to build new shelter. There are a couple of things that are pretty definite, but we can bring you a budget of kind of like what's in the hopper. We've also got some excess revenue from the GA program in FY25.
Yeah.
And we've also, I think it was 10 million that was allocated last year
Yeah.
toward shelter, much of which has been committed, but not all.
So it would be helpful to see, I know that I've got a list of all the housing that's been going on. I got that. But I would say specific things that have been built, but the money that's been invested in housing would be helpful to know, and shelters. If this can be used in the next budget year, or if it's something that can be forward rolled over and discussed in the next year. And so I'm looking at Lily. She's got me about that.
Thank you so much. So if everything goes to plan,
Oh,
then we are anticipating that we would need at least already sort of 1 million of the 2 million for something next year to help continue the growth.
okay.
If some of these projects do not go to plan,
Yeah.
then potentially we could use that money for this project that has a $1 million. So at this point, we are, again, positive thinking, assuming it all works out, thinking that we would need to tap into at least 1 of the million. I think we can definitely use the whole amount, but we've already kind of identified half of it for a project. Again, these are real estate acquisitions and renovation projects, and sometimes they just don't come to fruition.
Okay, so it would be helpful just to see that where
Okay.
those projects are and how this would be appropriated for that. and it will help us defend whatever amount of money is here in the bill. And that's similar for the transformation assistance and the 6.5 that's up there that we've asked for already. Senator.
Mike, thank you, Chair Lyons. I am curious, for the Commissioner of, Children and Families. So the 6.5, do you have a sense of how it'll be allocated to the, CAAs and the, what we call like a network? Because it needs to be distributed to those two. You have a sense of,
Yeah, thank you, Senator. I think we have a sense for the network, what that might look like. But for the community action agencies, I think that's the further clarification that you're going to get in the next couple of days from them on a transition budget.
So I think we're gonna look at that on Friday.
All right,
If there's anything earlier, let us know. We might be able to eke some time out tomorrow.
Okay.
Thank you. Yeah, so I mean, this is all important. We don't just want to throw money out, see what happens. We want to make sure that it's very deliberative. Okay. Other questions? Senator Douglas, you got how many of your questions? We're good. All right.
Okay. The next section is a legislative intent section. Then in fiscal year 27 and thereafter, equivalent funds and resources based on time used in fiscal year 25 for GA emergency housing be redesignated to BHART. Then in fiscal year 28 and thereafter, equivalent funds and resources based on one time used in fiscal year 25 for HOP be redesignated to BHART. And then you have transition language. As part of its fiscal year 28 budget presentation, BCF is to present a plan for transitioning HOP funding to and duties to VHART. And then,
Oh, I know. I have a question. Sorry. And I'm looking behind you. So the goal of this bill is to reduce our dependence on motel. So I want to know, is there a projected savings to what we currently have in the budget? We'll be able to see that one. And then transitioning to this 5 cap work. Goes back to Senator Cummings' question. Are you projecting savings? So the money becomes a big deal for us. Not that the human beings who are being served isn't number one priority, but so how are you looking at, or how are we collectively looking at savings? So we're setting a goal to reduce hotel. Yes, by consolidating those little blocks for hotel use, by increasing shelter and housing. So if we did everything on the list, how much of the $30 million that currently goes to GA would we be saving? Do you have any thoughts on that, or is that too difficult? I know how difficult it is to project savings. Nolan probably can help us more with telling me how difficult that is. Not I can hold it. Just a thought.
Yeah, that's a tough one, Senator. I think the intent is to reduce the reliance on hotels and motels over time and save money there, and have that money be allocated somewhere else. So I think overall, we're still going to have a significant issue with homelessness. And we can help. And I also want to kind of point out that the 1-for-1 of hotel rooms, the shelter beds, shelter is more expensive than a hotel room. But you see better outcomes and more services typically. So it's not necessarily a 1-to-1 over time. You reduce one hotel room and you can build one shelter bed. So we would be spending the GA money in a different way, in a more effective way that hopefully helps people more deeply. And to be, perfectly honest, with that same amount of money, you may help fewer people, but you may help them more.
We're gonna get to that point sooner or later where we're below both the thing, but
For the record, Illinois One Joint Fest Clubs, I actually agree with Chris.
yeah,
No real way to measure where the money all flows. The only way to really measure it is in outcomes. Are people moving out of hotels and a good money? I think the only way to measure it is the outcomes, not the money, because the money's gonna get spent other ways, not really savings. They'll just be money used for other purposes.
right.
And not necessarily one-to-one hotel room to shelter bed. It could be to services, prevention, diversion, other interventions that can help people who are experiencing homelessness.
Well, it will reduce the headache that is sitting in this chair.
That's my concern.
Yes.
Our real goal is to reduce our headaches.
Yes.
That's an advantage.
Okay. And a couple other chairs and stuff like that. Okay, so where are we?
We're at the end, we're at the effective dates, and we've already talked about how we have tiered effective dates, and that's reflected here.
Okay. All right. Committee comments, questions? Big deal. Go on.
I was thankful that earlier Amy brought up that we're gonna have hopefully by the end of the week a budget from the caps or the cows, so that we can take a look at that. She also said there's a document that we should take a look at on the webpage, just to answer some of the questions that we asked earlier. So that's good. And yeah, I think, we still should take a look at the advisory councils because there may be some things we want to change there.
So the regional advisory council?
Yeah.
So, yeah, okay.
Could we ask
Go ahead.
administration what it's costing to administer the program now?
Well, that is,
We've heard about the phone bank that could be done away, but what kind of ongoing support to administrators funding are we planning? So is it coming out? You get people out of the motel, is that where your money is coming from?
can we get something on that?
Yes. Yeah, we'll get you a breakdown.
Good. Yeah, so we're getting to try and understand what consolidation, localization, decentralization with ongoing regulation mean.
Wait, I think it's.
What is that? What is our favorite saying? What is it? What is it?
Decentralization with required coordination.
Yes. Okay, any other questions for Katie at this point, or any comments?
I had asked Katie earlier, but I don't want to overtax her for a timeline. that shows-
Oh, right.
Dates in the bill,
Yeah,
I can do that,
Can you do that?
sure, it'll be probably more like a chart.
Yeah, that's good.
Okay.
Because tomorrow we're looking at a different bill. We're looking at H 237, a kind of an intervening opportunity for people to go out and think, including us. But I used to tell my students, it's really important to have a day of reflection before you finally get the points to decision making. So, yeah, so we could look at a timeline, maybe. Great.
Sure.
But are you on the bill tomorrow?
Yeah.
Yeah, okay, good. Yeah, I get it. All right, good. Just see. What time?
at 11:30, we're gonna transition to 260.
Yeah, gonna do that.
Sorry.
Second it. That's okay. No, it's fine. Yeah, tomorrow we're looking at 237 and then coming back to 238. That's an important one. To make some decisions about. So we'll. A few things tomorrow, and then we'll come back to this and spend the morning on. H91. My ask for Friday morning is this. Can you do 8:30? I don't know, we may not, I can't predict, okay, we can't do it.
because I'm in
You have that, so I may have a conference committee, so we'll stick with 9. Our goal is to try to get some work done on this bill so we can. Have a vote, some markup and vote on it.
We will work with alacrity.
We will work with alacrity.
I can have a new draft for you on Friday. Just do the little.
Well, I don't know, wait,
Do you want me to
till we
wait?
get the budget stuff in, and we've got some other things like, the intake stuff.
Okay.
And the eligibility, and that, so don't do it yet.
Okay.
Do it yet. Okay. And then, well, if we do it, if we have the information we need on Friday, then we can look at a clean copy on Tuesday.
Great.
Okay. Does that work?
Mm-hmm.
All right, so we're gonna take a break till 11:30, and then Jen will be in